Hello, my name is Christian Grebe. I'm a researcher of Professor Anecdotal Latex Intellectual Disability Nursing Research Group at Bielefeld University of Applied Sciences in Germany. This presentation is about a training program that we developed and implemented to qualify people with intellectual disabilities to act as co-researchers in research projects. Since 2.5 decades, it's broad consensus amongst intellectual disability researchers that research in this field should always be emancipatory. In inclusive research, how we call it, our objective always is to give voice to people with intellectual disability. As described by Walmsley and Johnson, this means to involve people with intellectual disability with their ideas, their views and their values in all steps of the research project. So this means that they act as the initiators of a research project, as interviewers, as analysts of the data, and finally, ideally, also as authors, disseminators, and as the users of the results of this kind of research. We implemented a program with weekly sessions over a period of approximately 7 months. One of our professional researchers with an educational and linguistic qualification and experiences in working with people with intellectual disability supports this process and works with a co-researcher group and promotes activation of knowledge and experiences. The first step of the program is to recruit the co-researchers and building up a relationship with them and amongst each other. The second step is the analysis of communication skills. When we recruited the co-researchers, we already paid attention to a relatively homogeneous level of communication skills. After the group constituted, we used 2 meetings for a more detailed analysis based on the Common European Framework of References for Languages. And the purpose of this analysis was to ensure that our moderator is aware of the language level, skills, and limitations of each individual, and is then able to develop communication strategies for the entire group. The third step comprises exercises carried out with an open, flexible approach that takes into account the individual biographies, knowledge, skills, and interests of each of the co-researchers and of the team as a whole. In this step, the co-researchers work on the choice of their research topic, on formulating research questions, on developing an interview guide, and finally conduct qualitative interviews. Let's have a closer look into step 3 on the next slide. So our superior topic, of course, was health, but our objective was, of course, to let the co-researchers choose the specific topic within this framework. We produced photos and videos to address the health problems mentioned by the co-researchers and to support the teaching and discussing. On the bottom of this slide, you can see some examples for lower back pain, physical disability, headache, and vaccination. The finally selected topic was pain. To enable the co-researchers to formulate research questions and to develop an interview guide and finally to conduct interviews, we invested 2 months for teaching tasks, fields, and methods of research, and 4 additional months in teaching and discussing basic interviewing skills, which means communication techniques, how to generate new questions, how to interact during a conversation, on how to paraphrase not understood questions, on the sensitization for the interview partners, and the perception of feelings in the course of the conversation. And finally, the technical aspects of using a voice recorder. So up to now, we qualified the co-researcher group to select a topic, pain, to develop an interview guide, and to conduct qualitative interviews. And these interviews were scheduled for early 2020, but could not be realized because of the pandemic situation. We hope that the implementation and the conduction of the interviews can hopefully be done this autumn. We intend to continue to work with this group and use their built-up competencies in further research projects. And we still look forward to all the positive surprises still to come. Thank you very much for your attention.